Welcome to The Explainer. Today we're decoding something every single one of us has experienced. Usually at like 3 a.m., right? We're taking a close look at that sudden, violent, yet absolutely essential biological reflex we all know as the common cough. We're going to break down exactly what happens in your body, why it happens, and how completely different medical philosophies approach stopping it.
Okay, let's dive into this. Let's quickly run through our roadmap for The Explainer. 1. Why do we cough? 2. The cough timeline. 3. Red flags and complications. 4. Conventional medical treatments. And 5. The homeopathic approach.
So the first thing to get your head around is that a cough is not actually a disease itself. It's a highly coordinated, incredibly high-velocity protective reflex. It is literally your body's primary defense mechanism to clear out irritants, mucus, and foreign pathogens from your airways. Think of it kind of like an involuntary internal explosion that's specifically designed to keep your lungs safe and clear. And the biological sequence of this internal explosion is honestly fascinating. First, chemical or mechanical receptors in your airways get triggered by something. Maybe it's a sudden change in temperature, an irritant like smoke, or just some excess mucus. These receptors instantly fire signals straight up your vagal nerve and right into the medullary cough center of your brain. Your brain then sends a rapid-fire command right back down. You take a deep breath, your glottis closes tightly, and your expiratory muscles forcefully contract. The pressure builds and builds until, boom, your glottis bursts open, expelling that air and hopefully the irritant at a wildly high velocity.
Now, if you've ever felt completely exhausted by a cough that just won't quit, you are definitely not alone. The sheer scale of this reflex is staggering. Every single year, over 12 million adults in the US alone seek medical treatment for a chronic cough. 12 million! Globally, we're talking about roughly 8 to 10% of the entire adult population. It's a massive driver of healthcare visits, and let's be real, a huge drain on our overall quality of life.
Section 1. Why do we cough? The anatomy of an annoyance. So what exactly is triggering all these millions of doctor visits? Let's uncover the underlying reasons this complex reflex actually gets activated. Now, what's really interesting here is how wildly diverse the culprits behind a cough can actually be. We usually just jump straight to viral and bacterial infections, right? The common cold, the flu, pneumonia, but a huge percentage of coughs are triggered by things that have absolutely nothing to do with a lung infection. Asthma and postnasal drip from allergies are major offenders. Even acid reflux, or GERD, can trigger a cough because stomach acid actually backs up and irritates your upper airways. And get this, even certain blood pressure medications, specifically ACE inhibitors, can chemically stimulate those airway receptors and cause a really persistent dry cough.
Moving on to Section 2, the cough timeline. Mapping your symptoms. Because there are just so many different causes out there, the medical community relies heavily on a strict chronological timeline to start narrowing down a diagnosis. Let's look at how symptoms map out over time. The standard medical framework for classifying a cough breaks down like this. An acute cough lasts for less than 3 weeks. A subacute cough lingers somewhere from 3 to 8 weeks. And a chronic cough is anything that persists for more than 8 weeks or more than 4 weeks if we're talking about kids.
Let's break down how the actual causes shift across these different phases. During the acute phase, so under 3 weeks, the cause is almost always an active viral or bacterial infection, like bronchitis or the flu. But as we move into that subacute phase of 3 to 8 weeks, that active infection is usually long gone. What you're left with is post-infectious airway inflammation. Basically, your cough receptors are just highly sensitized and taking their sweet time to calm down. Finally, if you hit that chronic phase of over 8 weeks, the physical causes shift completely. We aren't looking at an infection anymore. We're looking at persistent structural or inflammatory issues. Things like undiagnosed asthma, acid reflux, or chronic sinusitis.
Section 3. Red flags and complications. When to worry. Now, while the timeline definitely helps with diagnosis, it is super crucial to know when a cough stops being just a simple annoyance and starts becoming a medical emergency. Let's talk about the serious physical toll this reflex can take.
Look, most coughs are perfectly benign, but the high-pressure mechanics of coughing can actually be really destructive. Warning signs that demand immediate medical attention include hemoptysis, which is coughing up blood, as well as unexplained weight loss, a persistent fever, or any sort of difficulty breathing. Because those expiratory muscle contractions are so violent, severe coughing fits can literally cause you to vomit, pass out, or, and this is completely wild to think about, even fracture your own ribs. If any of these red flags pop up, it is an immediate trip to a healthcare provider, no questions asked.
Okay, Section 4, Conventional Medical Treatments, Targeting the Underlying Cause. Assuming there are no immediate red flags, how do we actually stop the coughing? We're going to look at the diverse landscape of treatments, starting with the conventional medical approach, which focuses strictly on identifying and treating the underlying disease.
The conventional toolbox aims to directly target that physiological trigger. For simple symptom relief, doctors might suggest over-the-counter suppressants like dextromethorphan to kind of calm the brain's cough center, or expectorants like guaifenesin to thin out the mucus. If it's a bacterial infection, and strictly bacterial, antibiotics are used. For asthma or COPD, inhalers and steroids help bring down the airway inflammation. And for those incredibly severe chronic coughs that just won't respond to anything else, known as refractory cases, doctors might even prescribe neuromodulators like gabapentin to effectively turn down the volume on those hyperactive nerve signals.
What's really fascinating about the conventional approach is that medications are sometimes used as both a treatment and a diagnostic tool at the exact same time. For example, if a doctor suspects your chronic cough is being caused by stomach acid, they might just put you on a 4-week trial of acid suppression medication. If your cough goes away, well, they haven't just treated the symptom, they've successfully pinpointed the root cause.
Section 5, the homeopathic approach, treating the unique character. Now, let's pivot and look at the alternative medicine perspective. Homeopathy approaches this exact same biological reflex using a completely different methodology.
And this brilliantly illustrates the philosophical split between the two paradigms. While conventional medicine looks for a generalized underlying disease like asthma or a viral infection, homeopathy doesn't treat that generalized disease label. Instead, homeopathy seeks to match a highly diluted remedy to the incredibly unique, individualized character of the patient's specific cough. It focuses on the peculiarities, what makes the cough better, what makes it worse, and exactly how does it sound and feel.
To really see this in practice, let's explore how a homeopathic practitioner actually differentiates between remedies. If a cough is sudden, violent, and triggered by a cold wind, they might match it with aconite. But if the cough is incredibly dry, hard, and so painful that the person physically has to hold their chest when moving, that matches the profile for bryonia. A cough featuring violent bouts that lead to retching, specifically getting worse when lying down in bed, calls for Drosera. And if the cough has a highly specific, dry, barking sound, which homeopathic literature actually describes as sounding like sawing through a wooden board, and it's eased by warm food and drink, well, the remedy match there is Spongia.
So, whether you're analyzing your symptoms through a conventional timeline or tracking the peculiar character of your cough for a homeopathic remedy, the core medical takeaway remains grounded in basic biology. As the Cleveland Clinic summarizes perfectly, coughing is your body's way of protecting you. It is a necessary, vital defense. But if you're coughing so much that you literally cannot catch your breath, or it's persisting for weeks on end, it's definitely time to let a healthcare provider figure out why your internal alarm system won't turn off.
Which leaves us with a really fascinating thought to consider. This violent, high-velocity reflex has evolved over millions of years to keep our lungs clear of ancient dust and common viruses. But as our modern environment rapidly changes with new synthetic chemicals, unprecedented air pollution, and novel pathogens emerging all the time, how will this ancient biological alarm system continue to adapt to protect our airways in the future? It's definitely something to think about the next time you feel that little tickle in the back of your throat. Thank you so much for joining me for this explainer. Keep learning, keep questioning, and I'll catch you next time.